If your penis has started bending, there are a few things you really should not do. Do not panic, do not ignore it, do not try to force it straight, do not aggressively massage it, do not use extreme pressure with a penis pump, and please do not buy the first miracle cure you see online. A new bend in the penis can be scary. It can feel embarrassing, it can make you worry about sex, your relationship, your confidence, and whether things are going to keep getting worse. But the decisions you make early can really matter. So in this video, I'm going to talk to you about what not to do if your penis starts bending, what signs suggest it could be Peyronie's disease, and when to get help. I'm Melissa Hadley Barrett from Restorative Health Clinic, and we help men every day with erectile dysfunction, Peyronie's disease, penile rehabilitation, prostate cancer recovery, and men's sexual health concerns. Before we start, this video is for general education only. It does not replace individual medical advice. If you have a new bend, pain, a lump, erectile changes, or you are worried, please see a suitably trained health professional. Now, first things first, not every curved penis is Peyronie's disease. Many men naturally have some curve to their erection. Some curve upwards, some downwards, and some lean slightly to the left or right. If it's always been that way and it's not painful, you can have sex comfortably and you're not bothered by it, then it may simply be your normal anatomy. A penis does not have to be perfectly straight to be normal, but if the curve is new, changing, painful, or interfering with sex, that's different. That is when we start thinking about Peyronie's disease. Peyronie's disease is a condition where a scar tissue, often called a plaque, forms in the tunica albuginea. That is the strong layer around the erectile tissue of the penis. During an erection, this penis needs to expand, but if one area is scarred and less stretchy, that area cannot expand normally. So the penis can bend towards the scarred area. It can also shorten, narrow, indent, form an hourglass shape, become painful, or become less erect. Peyronie's disease is often linked to injury or micro-injury of the penis. Some men remember the specific event. They may remember the penis bending during sex, they may remember pain, swelling, or hearing or feeling something unusual. But many men do not remember a specific injury at all. They simply notice that one day the erection looks different. That story is very common. If that sounds like what you're experiencing, remembering that you don't have to figure this out alone. At Restorative Health Clinic, we specialise in helping men navigate these exact changes through discreet telehealth appointments. You can find the link to book a chat with us in the description below. But right now, let's talk about exactly what not to do. Number 1, do not ignore a new or changing bend. If your penis has always had a mild curve and nothing has changed, then it's not a problem. But if the bend is new, worsening, painful, or making sex difficult, please do not just ignore it. Peyronie's disease has an active phase and a stable phase. The active phase is where the scar tissue may still be forming and the curve may still be changing. Pain is more common in this stage. The stable phase is when the pain has often settled and the curve has stopped changing. This matters because treatment decisions can depend on the stage. Some men are told, just wait and it'll go away. But that is not what always happens. Some men improve, but many men remain stable or worsen. One common statistic is that only about 12 to 13% improve, while many remain stable or worsen over time. So if things are changing, get assessed. You do not have to panic, but you also do not need to sit at home worrying and hoping that it disappears. Number 2, do not try to force the penis straight. This is a big one. Please do not grab the penis and forcibly bend it back the other way. Do not try to crack it. Do not aggressively stretch it. Do not use your hands to force it into a straight position during an erection. That can cause further injury. Peyronie's disease is thought to involve abnormal wound healing after trauma or microtrauma. So adding more trauma is not a good plan. There are proper medical traction devices that may be used in some Peyronie's treatment plans, but that is not the same as aggressively yanking, bending, or forcing the penis straight. Traction therapy uses controlled gentle force, specific positioning, and a structured plan. Random forceful bending does not. Number 3, do not do Jelqing or aggressive penis exercises. You may see videos online about Jelqing, penis stretching, or manual exercises that promise to straighten or enlarge the penis. Be very careful. Jelqing usually involves repeated squeezing, pulling, or milking movements along the penis. The theory is often that microtrauma will create growth, but in Peyronie's disease, microtrauma is exactly the kind of thing we are trying to avoid. Improper stretching, massaging, or Jelqing can cause pain, bruising, scarring, erectile dysfunction, or worsening of Peyronie's symptoms. So please Do not start aggressive treatment without proper guidance. If traction therapy is appropriate for you, use a proper device and a proper treatment plan. Number 4, do not use a penis pump aggressively. A vacuum erection device or penis pump can be useful for some men. It may help men with erectile dysfunction. It may be used in penile rehabilitation. And in some cases, it may be part of a broader Peyronie's management plan. But pressure matters, technique matters, and more suction is not better. Do not pump to pain. Do not try to force the curve out with vacuum pressure. Do not use extreme suction because you think it'll break up the scar. That can lead to bruising, swelling, pain, numbness, and injury. If you are using a pump, it should be gentle, controlled, and ideally recommended as part of a proper plan. This is especially important if you already have pain, curvature, narrowing, hourglass deformity, or erectile dysfunction. Number 5, do not assume it's only a cosmetic issue. Peyronie's disease is not dangerous in the way cancer is dangerous, but that does not mean it's nothing. For some men, it causes painful erections. For some, it causes erectile dysfunction. For some, it makes penetration difficult or even impossible. And for some, it causes shortening, indentation, or instability during sex. And for many men, it has a huge emotional impact. Men may avoid sex, they may feel embarrassed, they may worry about what their partner thinks, they may feel grief because their body has changed. Peyronie's disease can significantly affect quality of life, sexual function, confidence, and relationships. So if it bothers you, it matters. You do not need to minimise it. Number 6, do not assume a bend means you definitely need surgery. This is another common fear. A man notices a bend and immediately thinks, I'm going to need surgery. Not necessarily. Treatment depends on the stage, the severity of the curve, the erectile function, pain, deformity, and how much it bothers the person. Some men just need reassurance and monitoring. Others will benefit from traction therapy. We might also focus on support for erectile dysfunction or consider injection therapies. And yes, some men with stable, significant curvature or severe functional problems may discuss surgery. But surgery is usually considered after conservative treatment has failed and only once the disease is stable and if the deformity is causing significant functional problems. Surgical treatment is usually reserved for when the curve stabilises, commonly after symptoms have been present for at least 12 months and curvature has been stable for several months. So please do not assume surgery is the only option. Get assessed first. Number 7, do not assume tablets or supplements will dissolve the plaque. There are many pills, vitamins, creams and supplements marketed for Peyronie's disease. Be cautious. Some oral treatments have been studied and have been found to assist when part of a multimodal treatment plan, but many supplements promoted online do not have any evidence that they reliably straighten the penis or dissolve plaque. Historically, things like vitamin E have been recommended, but medical guidelines do not support vitamin E as an effective treatment for Peyronie's disease. That does not mean there is nothing that can be done. It means you should be careful about spending money on products that promise a cure without good evidence. Number 8, do not ignore erectile dysfunction. Peyronie's disease and erectile dysfunction often happen together. Sometimes erectile dysfunction comes first. If erections are not as firm as they should be, the penis may be more vulnerable to bending or buckling during sex. Sometimes Peyronie's causes erectile difficulties because the deformity makes penetration harder. Sometimes pain and anxiety make erections less reliable. And sometimes both are happening at the same time. One of the most important questions in an assessment is, if the penis was straight, would the erection be firm enough for penetration? Because if the answer is no, then treating the curve alone may not solve the problem. You may also need an erectile dysfunction plan. That might include lifestyle factors, vascular risk assessment, medications, injections, vacuum devices, hormone assessment, pelvic floor assessment, or referral to a specialist. The curve matters, but the erection quality matters too. Number 9, do not assume it's Peyronie's if it has always been curved. This is important, especially for younger men. If the penis is always curved in the same direction, especially from the time erection started, it may be congenital curvature rather than Peyronie's disease. Congenital curvature is different. It's not caused by a new plaque. There may be no lump, there may be no pain, and the history usually sounds like it's always been like this. Peyronie's usually sounds more like this is new or it changed. It's important to make this distinction clearly. Congenital curvature is usually lifelong, while Peyronie's is an acquired change associated with scar tissue or plaque. If you are not sure, get checked, but do not panic just because your penis is not perfectly straight. Number 10. Do not keep it a secret if it's affecting your sex life or your relationship. A lot of men suffer silently with Peyronie's disease. They avoid sex, they stop initiating intimacy, they worry their partner will be shocked, they feel ashamed, but silence often makes the anxiety worse. If you have a partner and it feels safe to do so, talk to them. You do not need to have all the answers. You can say, I've noticed a change and I'm worried about it. I'm going to get it checked. I may need some support while I work this out. Many partners would rather know what's been happening than be left wondering why intimacy has changed. And if the emotional impact feels heavy, support from a clinician, sex therapist, psychologist or counsellor can be very helpful. This is not just a penis issue. It can be a confidence, relationship and identity issue as well. Number 11, do not wait until sex is impossible. Some men wait years before getting help. They wait until the curve is severe, they wait until penetration is impossible. They wait until their confidence has collapsed, they wait until erectile dysfunction has worsened. You do not need to wait that long. A good time to seek help is when you first notice a new bend, pain, lump, indentation, shortening, hourglass shape, hinging or erectile change. Early assessment does not mean you will need aggressive treatment. It means you understand what is happening, you can monitor it properly, you can learn what to avoid, and you can make a plan. Number 12, do not assume that there's nothing that can be done. This may be the most important point. Many men are still told, just live with it, or there's nothing you can do. That is not true, and you have real options. It starts with proper assessment, treatment, and ongoing monitoring. For some, the focus is on erectile dysfunction, treatment, or targeted penile traction therapy. Others may benefit from injection therapies, and for stable and severe cases, we can discuss surgical options. But just as importantly, there is dedicated support for your confidence, your intimacy, and your relationship. The right approach depends on the person, but you deserve to know your options. Now, let's talk about when to get urgent or prompt medical help. If the penis suddenly bends during sex and you hear a pop or feel severe pain, lose the erection quickly, or develop rapid swelling and bruising, that could mean a penile fracture. That is an emergency. Seek urgent medical care. That is different from Peyronie's disease. For Peyronie's disease itself, book an assessment if you have a new or worsening bend, pain with erections, lump or plaque, indentation, hourglass narrowing, shortening, hinging, difficulty with penetration, or changes in your erection quality. Now, what should you do instead? First, take note of when you notice the change. Second, notice whether there is pain. Third, notice whether the curve is changing. Fourth, notice whether erections are still firm enough for sex. Fifth, avoid forceful bending, aggressive exercises, and extreme pump pressure. 6, seek a medical assessment from someone who understands men's sexual health and Peyronie's disease. A clinician may ask about your symptoms, examine for plaque, assess erectile function, and in some cases arrange a penile ultrasound or a referral to a urologist. They may also ask you to provide photos of your erect penis from specific angles so the degree and direction of the curvature can be assessed. This can help track change over time and plan treatment. So let's summarise. If your penis starts bending, do not panic. Do not ignore it. Do not force it straight. Do not try aggressive exercises like Jelqing, and do not use extreme pump pressure. Don't waste money on miracle supplements. Do not assume surgery is your only option, and please do not suffer in silence and assume there is nothing that can be done. A curved penis is not always a problem, but a new, painful, worsening or function-limiting curve is worth getting checked. At Restorative Health Clinic, we help men work out whether their curvature may be Peyronie's disease, whether erectile dysfunction is also involved, and what the next step should be. That might include education, monitoring, penile rehabilitation, vacuum device guidance, traction therapy discussion, erectile dysfunction treatment, or a referral to a urologist when needed. If you're worried about a new bend, painful erections, a lump, shortening, hourglass shape, or erectile changes, you can book a telehealth appointment with our team. I'll put the link below, and if this video was helpful, please subscribe because we have more videos coming on Peyronie's disease, penis curvature, penile traction, penis pumps, erectile dysfunction, and penile rehabilitation. Thanks for watching, and remember, do not panic, do not force it, and do not ignore it. A new bend is something you can get help for. I'll see you in the next video.